Hi guys, this is just a review of chapter 3. One thing that I'm going to be doing is I'm going to kind of buzz through this. I am not looking at for you to remember all of these bones. That is not the object of this. I want you to learn the medical terms. You do need to know some of the major bones, and we'll kind of go through and I'll touch base on those as we go. In the first part of your book, it's always going to give you a list of the combining forms in the body, in the system that we're looking at. So please make sure you are learning those. It's ultimately important. So we know that learning the function of each body system is incredibly important. So the function of the skeletal system is to provide a framework for the body, to provide support and protect our internal organs. We'll talk a little bit more of that as we go through. It also helps provide movement through our joints. It's a storage of important minerals, calcium, and we need that for nerve and muscle function, and that is stored in our bones. And then our red bone marrow, which actually plays a huge piece in the formation of our blood cells. Now, you can actually look through all this wonderful material. Look at this. Diaphysis is the shaft of the long bone. Epiphysis is the end of the long bones. You can go through this. I am not going to be asking tons of questions about that. Please review it, but I'm not so worried about learning all that information. Okay. Cartilage is actually a connective tissue that acts like a shock absorber for our bones. It actually works wonders to be able to help when we're jumping, running, those type of things. Okay, you can actually see the different cartilage that's here. Again, this goes into the anatomical landmarks of bones, the diaphysis, the epiphyses. You can read all about that in your text. Again, the foramen, that's going to be an opening in a bone that allows the passage of blood vessels, nerves, ligaments, spinal cord. And then a process is just a projection on the bone that allows for the attachment of muscles or tendons. Joints, we know that we have plenty of different types of joints in our body. It's usually two or more bones that are being connected, and they are classified according to movement. We have fibrous joints, and they are also called suture joints. These are joints that don't allow movement. We see a lot of these in the skull. We then have cartilaginous joints, and those joints allow for just slight movement in the body. Then we have synovial joints, and most people relate this type of joint to when we talk about joints. So we're talking about the hip, the elbow, the knee joints. There's different types of synovial joints. There's a ball and socket, which is like the hip, which can rotate. And then we have the hinge joint, which just moves something up and down. The components of synovial joints, we need to have that synovial capsule or a membrane. What that does is it lubricates that joint for us so we can move it and it doesn't hurt. There are also ligaments. Those are fibrous tissues that connect a bone to one bone to another bone. And then we have those lovely little bursa. They're little sacs right by our joints that actually help ease in movement and don't let a lot of friction to happen until we get some inflammation. If we get bursitis, it is very, very painful. The axial skeleton actually protects the major organs of the nervous system, the respiratory system, and circulatory system. And you can see it's organized into different parts. But what I want you to know is that it protects these major organs. The appendicular skeleton actually protects the organs of the digestive, excretion, and reproductive system. So they protect different parts. Now, again, I am not going to be asking you the name of all of these bones. What I just want you to look at, see the coronal suture here and all these different sutures along this. Those are those joints that we talked about that they are formed and they don't move. The skull joints do not move. Okay. The thoracic cavity is also known as the rib cage. It protects our heart and lungs. So when we look at the ribs, again, we have 12 pairs. There's true ribs, false ribs, and floating ribs. You can look at that in your text to see which ones are where. The one thing that I want to point out here, the most important thing I want to point out, is I want you to look at this word, costal, okay? When I ask you on your test to define a word, this is exactly what I want you to do. I don't want you to give me a 15-word definition of what costal means. I want a literal definition pertaining to the ribs. So we remember, we start at the suffix and then we go back to the beginning of the word and then define that. So AL means pertaining to, costo is ribs. So it's all I would want you to say is pertaining to the ribs as your answer. When we look here, again, here is our thoracic cavity. When I talked about the process, see the acromion right here? The acromion process is actually something that we use in healthcare as an anatomical landmark to do injections. So we locate the acromion process, we use 3 fingers, we go down, and that's helping us identify where the deltoid muscle is to be able to give an intramuscular injection. We're going to look at the bones of the arm. You can see here the long top bone is a humerus. Notice the spelling. It's not O-U-S, it's just U-S. The radius and the ulna. The radius is on the thumb side. The ulna is on our pinky side. And again, I'm not going to ask you to be locating distal and all that. Just know that the phalanges are at the end of the fingers, the metacarpals are the middle bones, and the carpals are there where it meets the wrist. The spinal column actually supports the head and the body, and it protects the spinal cord. That is the major function of that spinal column. We have 26 different vertebrae, and you can see this is where the spinal column, remember when we said that foramen is a hole that different things go through? This is where the spinal column is going to go through. Okay. There are different parts to the spinal column. Our cervical vertebrae are C1 through 7. They're at the top. The thoracic vertebrae are 1 through 12. The lumbar are the next through 1 through 5. Then we have the sacrum and then the coccyx. And again, it tells you a little bit more about that. The cervical vertebrae form the neck. The thoracic vertebrae, actually a pair of ribs attached to each one of those. The lumbar vertebrae are the largest and strongest, and they bear most of our body weight. And then the sacrum actually form the lower portion of the back. They actually are 5 separate bones at birth, but as we grow, they form and fuse to be just one single bone. And then we have the coccyx. It's known as the tailbone. It forms the very end of the spine. And again, it's 4 small bones that fuse together. The pelvis, we can see ilium. This is going to be important. We talked about spelling. The ilium in the hip bone or the pelvis is an IUM. Ilium in the digestive system is EUM. So it's very, very important when we look at the spelling of these words that you know which one's which. The pelvis actually protects our internal organs. It supports our lower extremities. Again, I'm going to talk to you about this term, sacroiliac. If I asked you to define this on a test, it would be pertaining to the sacrum and the ilium, okay? literal definition. The ischium, the pubis, and the pubic symphysis are all part of the pelvis as well. The legs, again, the femur is going to be the largest bone in the leg. We then have the patella, which is the kneecap. Popliteal is a location behind the knee. You can actually have, this is where a lot of lymphs come in, and we also can feel a pulse behind our knee. Okay, cruciate ligaments are of the ligaments that allow our knee to move. The tibia is going to be the shin bone. It's the larger front or anterior bone, and the fibula is the smaller bone. So when we look here, we can see this is the femur, this is our tibia, and the fibula is behind that. Now, as we look at the foot, very much like the hand, we have the phalanges. This is the metatarsals. We have tarsals. Now, the calcaneus bone is our heel bone. Again, kind of going through, here's our calcaneus right here, that heel bone that can cause us so many problems. Specialties in the skeletal system, medical specialties, we could see a chiropractor, an orthopedic surgeon, a podiatrist, again, looking at the breaking down of words, a specialist who takes a specialist in feet. Rheumatologist is someone who looks at the diagnosis and treatment of arthritis. A lot of times, some of the arthritis that we're going to talk about is actually an autoimmune disease. So they look and do different testing to be able to determine if it's osteoarthritis or rheumatoid arthritis. There's a number of different pathologies in the skeletal system. I want you to be able to buzz through these and look at these. Ankylosis, again, is an abnormal condition of being crooked or bent. This is that loss of mobility due to a surgical procedure. We usually see somebody, with their spine crooked, and they're not able to walk as well. Arthrosclerosis, not athro. Look at the spelling. Arthrosclerosis is a abnormal hardening or stiffening of the joint. Again, that's exactly what I would want you to tell me. Baker's cyst, it is a nasty fluid-filled cyst that can be located behind the knee. Very, very painful for people. Bursitis, again, inflammation of the bursa. And when that happens, it gets very, very uncomfortable as the joint moves. Chondromalacia is going to be a softening of the cartilage. Costochondritis is going to be an inflammation of the cartilage and the ribs. Hallux valgus is actually an enlargement of the joint at the base of the great toe, better known as a bunion. That's the medical term for it. Polymyalgia is a pain in many muscles. A sprain is actually a wrenching or tearing of a ligament. And synovitis is actually an infinite inflammation of the synovial membrane. Again, it's going to cause a lot of pain because that synovial fluid or tissue is there to help smooth the movement. So if we have an inflammation of it, it's going to be very painful to move as we go. When we look at dislocation of the bone, a luxation is a total displacement of the bone from its joint. And then a subluxation is actually the partial displacement of a bone. Arthritis, there are so many different forms of arthritis. Osteoarthritis is the most common that is associated with aging. It actually wears away the articular cartilage in the joints, and we get bone against bone, and that's when we usually have to have a joint replacement at that point. Spondylosis, again, is a degenerative disorder causing the loss of spinal structure and function. Gout is very interesting. It is a type of arthritis, but it's actually caused by uric acid crystals in the joint. You're going to see usually very red, very hot, enlarged, swollen joint, generally of the feet. It can affect other places. Some people have it in their hand, but it is characterized by being very painful and very hot, large joints. Rheumatoid arthritis is actually an autoimmune disorder. Our body attacks itself. We'll be talking about that in other chapters as well. We have ankylosing spondylitis. Again, it's a form of rheumatoid arthritis. It causes inflammation of the joints between the vertebrae and is very, very painful. We also have juvenile rheumatoid arthritis. Again, an autoimmune disease. It affects children under the age of 16. We get a lot of stiffness, pain, joint swelling, slowed growth, fatigue. In some cases, it does not continue beyond childhood, but it is very, very painful, and they do have to be treated. Some of the other things we see with the spinal column: herniated disc, lumbago, spina bifida, that's going to be a congenital defect. It's when the spinal canal actually fails to close and part of the spinal cord is sticking out. What's neat now is they can do surgery while the baby is still in vitro, and they can actually close that. And we've seen very successful cases of this. It's done not in Cumberland, but in the large urban areas that have neonatal and perinatal type surgeries. These are very common: kyphosis, lordosis, and scoliosis. Kyphosis is an outward hump known as humpback. Lordosis is a forward curvature known as swayback, and scoliosis is going to be a curvature. It's a lateral curvature of the spine. So as we look at it, again, this is kyphosis. It's like a humpback. Lordosis is an internal, and how I remember this is, oh Lord, I'm pregnant, because it looks like the spine is pregnant. And then the scoliosis is like an S shape. It's a lateral curvature rather than an anterior or posterior curvature. Different terms that you may hear: osteolytis, osteomalacia, osteomyelitis. I'm going to look at this word again. Let's define it. It is the inflammation of the bone and the bone marrow. That's how I would want you to do that on a test. Hint, hint, hint. Okay. Rickets is actually a defective bone growth because of a lack of vitamin D in children. This is very, very treatable. We just give people an increase in their vitamin D. We do have some different types of dwarfism. There's a number of different types out there. And talipes is actually clubfoot. It is a congenital deformity of the foot. There are different types of bone cancers. We can have a primary bone cancer, which means that it originates in the bone, or a secondary bone cancer, which means it has metastasized to the bones from other organs. Myeloma is a cancer that occurs and is found in the red bone marrow because it is occurs in the blood-making cells that are found, those red blood cells and the blood cells that are made in that red bone marrow. Osteoporosis and osteopenia, there is a difference. Osteopenia is just a decrease or a deficiency of the bone. So let's look at it. Penia is deficiency of the bone. That's the definition. Osteoporosis is an abnormal condition of the bone, and pore means small opening. But what that means, it's the bone density, the porous nature of the bone. So if you've got osteoporosis, you're very easy to fracture a bone because the openings in the bone are very, very large. If you have osteopenia, there's things that they can do. They will increase your calcium level, your vitamin D, all of those different type things. There are different fractures. You need to know these fractures, okay? So compression fracture is just when you compress a bone to bone. Collies, we see this mostly when people fall and try to catch themselves. It's a fracture at the lower end of the radius, and it's when people fall on ice or older people fall and try to catch themselves. An osteoporotic hip fracture, again, it could be due to the osteoporosis. You don't even have to fall. Some people just in walking can actually break their hip because their bones are so porous. We also have the green stick, which is an incomplete fracture. We see this mostly with kids because their bones aren't set and formed yet. So we see that it's not all the way through. A closed simple fracture is the bone is broken all the way through, but it has not protruded out of the skin. Open fracture or a compound fracture, that is when a bone is broken and it is coming out of the skin. This has to be then treated by surgery. And then we have a comminuted, which just means it's a bone, it's crushed. You've actually crushed the bone, and you can see that here. Again, we have pathological fractures due to weakening bones. It's not due to trauma. So as I said, with older people who have terrible osteoporosis, their bone can break just as they're walking or going up the steps. Spiral fractures we see in abuse cases where somebody has twisted somebody's arm, and that's actually caused a fracture, a spiral fracture in that person. Stress fractures due to overuse, and a transverse fracture is just one that actually goes straight across the bone. One of the things that we may get is a fat embolus. When we get a broken bone, remember that yellow bone marrow is made out of fat. And so if that gets into the blood system, it can actually throw a fat embolus and can cause major issues with our patient. Crepitation or crepitus, that's, you get that grating sound when the bones move over together. Sometimes too, if air gets in there, you can actually hear the crepitus as well. Sorry. How do we diagnose? Well, we're going to use an x-ray. We can do arthroscopy, where we're going to be looking at the joint. Again, if I ask you what this means, it's a visual examination of the joint. We can do a bone marrow biopsy. We can use MRIs. We can do bone density testing. DEXA is one of the most normal tests we see after the age of 50. They'll actually do a test to make sure that we don't have osteopenia or osteoporosis. It's one of the best diagnostic tools. An orthotic is actually an appliance we use to correct, control, or compensate for a problem with a limb. Prosthesis is actually a substitute for a missing body part. Different types of terms that you're going to hear: arthrodesis, again, it's a surgical fusion of two bones; arthroscopic surgery; chondroplasty is a surgical repair of damaged cartilage; joint replacements, total knee replacement, TKR. Notice those abbreviations. Partial knee replacement, total hips. A hip resurfacing is they actually just replace a metal cap over the head of the femur to help with that function. Or if somebody has already had a total hip or a total knee, sometimes they have to do a revision surgery if it's worn out or if it has failed. Different terminology for the spinal column: laminectomy, again, surgical removal of the lamina. Craniectomy, surgical removal of the skull. Craniotomy is a surgical incision into the skull. And a cranioplasty is a surgical repair of the skull. That's exactly what I'm looking for your test. Close reduction, That means that the bone isn't popping out. We can actually manipulate it, realign it, and then cast it, hopefully, or use some type of immobilizing device to hold it in place to heal. If we have a open reduction, they do have to go in surgically and fix that. We also see traction. It actually pulls the bone apart to help for healing. We have external fixation, which again is when we have an external device holding the body in place during healing. Internal fixation, that's where we're going to use those plates and pins that we need to hold that broken bone in place to heal. The only thing left to say to you is make sure you are looking at your abbreviations at the end of the chapter. So closed reduction, fracture, FX, osteoarthritis is OA, osteoporosis is OP, total knee arthroplasty is a TKA. So anything along those lines. Those abbreviations that are not only at the end, but in your text are fair game. And I can promise you'll have at least 3 or 4 of those on your test. All right. Good luck.